is CGTN, China Global Television Network.
As Africa works towards bringing the COVID-19 pandemic under control, collaboration with the international community is paramount. The global crisis has afforded Africa and its partners an opportunity to build health capacities, share information and experiences in containing COVID-19. China is one such counterpart that has committed to helping Africa mitigate the emerging impacts. And this week saw the two sides meet virtually to consolidate their achievements, review the challenges, and discuss the way forward. This week, on this special edition of Talk Africa, we join a webinar organized by China's mission to the African Union and the UN Economic Commission for Africa to explore China and Africa's joint response against COVID-19. I'm Beatrice Marshall. Welcome to Talk Africa.
China and Africa are bound together by common interests, by safeguarding multilateralism and upholding international fairness and justice. The two sides are more than ever committed to upholding the multilateral system with the United Nations at the core and supporting the WHO in playing bigger role in the global fighting against COVID-19. With more, it's crucial to advocate the 5 principles and the peace, coexistence, and other basic norms governing international relations. We are ready to work closely and make a greater contribution to build the community with a shared future for mankind.
It is an important event that we have today because we're gathering to talk about what we can do together as a global community to respond to this crisis. Africa today is spending 2.5% of its GDP to respond to the COVID crisis through lockdowns. This is an expensive amount for a continent that does not have the resources to create the 13 million jobs it needs. So this conference is particularly important as we talk about this, because we're not only talking about fighting a health pandemic, we're talking about an economic crisis. And I think this is no time than ever for the true friendship between our countries to show by demonstrating that China is with Africa as we respond to this crisis by helping us to participate in the debt service suspension initiative. President Xi also committed to support us on the health crisis.
China actively advocates the international community to increase its support for anti-pandemic action in Africa. Support Africa has always been the key words of Chinese President Xi Jinping's speeches at the G20 Special Summit and the 73rd WHO meeting. No matter how the international situation changed, China-Africa friendship has always remained unshaken, carried on from generation to generation, and stood the test of time. I firmly believe that while China and Africa fight side by side and work together, we will surely be able to step out of the darkest period in human history and usher in a bright future for the common development and progress of China and Africa.
Let's now kick off our discussion today on how Africa and China can join hands in fighting COVID-19. And I'd like to welcome our first speaker on the panel, Ambassador Edward Sholisa Makaya, the permanent representative of the Republic of South Africa to the African Union and the Economic Commission for Africa. South Africa is the current chair of the African Union. He's going to start us off with our discussion this morning. Ambassador Sholisa Makaya, you have the floor.
First, it's critical that we acknowledge the spirit of cooperation and solidarity that characterize the relationship between Africa and the People's Republic of China. This historical solidarity and cooperation has been demonstrated in the collaboration to fight COVID-19 pandemic. Once more, we join the colleagues that have just spoken before us to express our profound gratitude to the Chinese government and the Chinese institutions for providing medical supplies to the African countries to help combat COVID-19 pandemic. The world is facing a grave and uncertain crisis as it continues to battle a virus that respects no borders, a virus that attacks countries big and small. The pandemic has presented profound health challenges, disrupted global economy, and continues to present serious threat to security and food security. It was against this background that the extraordinary China-Africa Summit was held. Moderator, there is much to be said on what needs to be done to implement the outcomes of the summit. In the interest of time, allow me just to underscore one important point. That is the need to implement all the outcomes of the summit as agreed to by our heads of state and government. We believe the implementation of these outcomes will serve as a stepping stone towards successful 2021 FOCAC program. These outcomes could be weaved into the follow-up mechanism of FOCAC with clear timeframes. There's a need to continue to support the continent, as the colleagues have said, with medical supplies and support the AU COVID-19 strategy. When the COVID-19 vaccine becomes available, it should be important that it becomes a global good, to be affordable to all countries and accessible to all countries, particularly developing countries. In this regard, we appreciate China's undertaking to make her COVID-19 vaccine, when available, a global public good, and hope that in due course, a vaccine against COVID-19 will be found. Lastly, moderator, we are now as a continent working full steam towards the extraordinary summit on the AFCFTA to be held on 5th December 2020. And the AFTA will help the continent in a big way, not only to boost inter-African trade, but also help us as a continent to deal with the persistent challenges that we have on the continent. The issues of insecurity on the continent, the issues of peace, the outcomes of the summit should be programmed to feed into the 2021 FOCAC. Since we are fighting a pandemic that is invisible, the only way we can do it is to continue to work together. This demands a strong Africa partnership. It requires total collaboration, cooperation, and global security. Thank you very much, Program Director.
Ambassador Edward Solisa Makaya, thank you very much. The permanent representative of the Republic of South Africa to the African Union and the ECA. Let's hear from our next speaker as we continue with this dialogue. Dr. Yuan Peng, the president of China Institute of Contemporary International Relations. You have the floor.
It's my honor to participate in this very important virtual conference. I think, first of all, I think the world is witness great changes, which unseen for centuries. I think the international order is dismantling, and the international relations is reshaping, and the global governance doesn't work well. And the COVID-19 happening this very critical moment make the unprecedented changes even faster, even more deeply. So in this moment, what we need is cooperation and coordination among countries under United Nations. So we do hope that US and China and other big countries can resume our good relations as fast as possible, so that we jointly deal with this very serious situation. I just read our data that yesterday the whole African continent has more than 1 million diseases. I think it's still worsening day by day. So how to deal with this, I think big powers should play some leading role. As for US, China and African relations, I think we always enjoyed the best shape in history, from Chairman Mao up to today, President Xi, and we value China-African relations the best. I think we'll use to call that we are good partners, good friends, and even good brothers. We didn't using good brothers for describing many other bilateral relations between China and others, but we always use this to describe our bilateral relations. One is how to sharing the experiences, because China, we endure this for the first in the world, but we overcome this very quickly. So we do have some experience can be shared. For example, we put people's life first rather than politics, rather than even economy first. And we locked down the Wuhan city very promptly. And after we overcome this pandemic, and we didn't open our economy that unconditionally. We just very cautiously and gradually open our economy and balance the counter pandemic and the reopening our economy. I think all those good experiences maybe cannot be copied, but we'd like to share. And the last but not least, I think is how to strengthen our political trust. I think today the political virus is more serious than the virus per se. We can see US and China relations. But today, even if China-African relations in a very good mood, but some media, in particular some Western media, are intentionally using some individual cases, occasional events, to make China-African relations, want to break this good cooperation. So I do hope, advocate all the participants that China-African political trust should be strengthened rather than be separated. I think it is more important than some tactical cooperation.
Let's now hear from Dr. Benedict Okechukwu Orama, the president of the African Export-Import Bank, Afri-Exim Bank.
African countries have made notable progress in the fight against the pandemic, but we all recognize the immense challenges that still lie ahead. Testing remains the lowest globally, and access to medical supplies and productive equipment remain very limited. A strong partnership with Africa's largest trading and economic partner will be beneficial to leveraging experience and resources the continent urgently needs to cope the pandemic. It will also stimulate a robust recovery of the African economies for the benefit of China and for the benefit of Africa. We thank the Export-Import Bank of China and the China Development Bank for their support so far as we mobilize resources to assist African economies to contain this pandemic. But the needs are huge. We need to see more support from China. The African Medical Supplies Platform, which has been presented, and I think Mr. Strive Masiyiwa, who is the AU envoy that championed this, presents a solid basis for delivering any assistance China may want to offer to Africa at this time. Afreximbank, as a co-developer and operator of the platform, plays a key role of a payment services provider under the platform. Accordingly, if and when the government of China favorably considers the $4 billion grant that the AU chairperson, His Excellency President Cyril Ramaphosa, has requested from China through His Excellency President Xi, Afreximbank can leverage its long-standing relationship with China Exim Bank to ensure that the $4 billion grant is implemented in a win-win manner for Africa and for China. It will help Africa to quickly contain the pandemic. It will help grow jobs in China. It will also help Africa to recover quickly and continue to grow its economic and trade relations with China. There is also the opportunity for Chinese entities to delocalize some of their production centers for COVID-19 materials to Africa. And we are pleased to hear from some of our Chinese colleagues that this is already happening. We hope that more of this will continue in the near future. May I now close by reiterating the need for a robust collaborative framework and support for China, and also to call on our people, the African people and the Chinese people, to work together to contain the pandemic, because a strong Africa, a strong China is good for both Africa and China. Thank you for listening.
We're now going to take a short break, but when we come back, we'll have more from the webinar on China-Africa joint response against COVID-19.
Life moves pretty fast. Ideas move at the speed of sound. Technology moves at the speed of light. If you don't filter out the noise, you might miss the details. We pay attention to the details because they matter, showing you a different perspective. See the difference.
Welcome back to the program. Let's now continue our discussion on China-Africa joint response against COVID-19. Our next speaker is Mr. Gao Fu. He's the director of the China Center for Disease Control. Mr. Gao.
So many colleagues already said something about solidarity. So I also want to address solidarity. So like Dr. Tedros said, solidarity, solidarity, and solidarity. When you are talking about solidarity, that means we got to work together. Though the COVID-19 virus was first isolated, discovered in China, in Wuhan province, and we got to work together to see to get the virus down. We had experience from the fighting against this virus in Wuhan. We won the Wuhan battle. China, we have already experienced several waves. When you are talking about waves, that waves could be very big, like the Wuhan outbreak, or could be very small, like what we had in Beijing. Obviously, we cracked down all those waves. So to be honest, we have some experience, we have some lessons to share with you and to work together with you. So most importantly, here I want to say, even inside China, solidarity is the key. So we call it as, the people's war. So this is the war. You got to get everybody activated. You got to get the virus to be controlled in the community level. I also want to address, during the outbreak, China CDC and also some other organizations, including some enterprises, are working together with our African colleagues, African people. I think my bosses there, the ambassadors, they mentioned something there. So obviously, we did some work to share our technological protocols. And also we donate some materials, like including the PPE, especially for some masks. But the most important thing, we have to foresee the future. You know, at the moment in China, we have several vaccines under clinical trials, including the inactivated vaccine. At the moment, it's in the phase 3 one of them. It's in the phase 3 clinical trials in United Arab Emirates. So there, I was told already 15,000 vaccinees, they are under clinical trials. I hope we will get something there. I am very, very cautiously, I say cautiously optimistic, like Dr. Tony Fauci. So we have this inactivated vaccine, I mentioned this. We also have some subunit vaccines that developed by my lab in the Chinese Academy of Sciences. So in addition, as Director General for China CDC, I also still have a lab in the Chinese Academy of Sciences there. We developed the subunit vaccine that will finish the phase 2 clinical trial soon. And also we have a adenovirus-based vaccine. You heard about that. That's the adenovirus 5. We also have, at least I know, 2 chimpanzee adenovirus-based vaccine. We also have an mRNA vaccine like the Moderna. So we have several others in the lab trials at the moment. So in my opinion, we have to think about the vaccine work. Maybe that's the work, like our president Xi Jinping said, this is the international public good. How would we use this international public good? That's really need a good strategy. Who should be prioritized to use those available vaccines? So that's really something we should talk about. We are ready to collaborate with everybody in Africa for any aspect to get this COVID-19 down. Like my president Xi Jinping said, though everybody, we get this really unprecedented event, that's really something dangerous, but that also provides something, a very good chance. That means though we encounter this serious problem, but we have a very good chance to change human behavior, to rethink what we should do, and what the whole human beings, and what kind of collaboration China and Africa should do. John and me, we always discuss. We wrote something in the Lancet Public Health last year, calling for, Africa-China collaboration, put public health as the priority. Disease control first, public health as priority. So that's my talk. Thank you very much. I'm ready to discuss with anything with my colleagues there. Thank you.
All right. Previous speakers have talked about the Africa CDC and the need for it to be supported. Now, disease surveillance and intelligence has never been more urgent than it is today. China has made a pledge to accelerate the building of the Africa CDC headquarters to help the continent ramp up its disease preparedness and control capacity. Dr. John Nkesagong is the director of the Africa Center for Disease Control and Prevention. I will give him the floor.
First of all, there are at least 3 key areas that we have learned from this pandemic. First of all, that diseases know no border, they respect no border. And that in just under 8 months, about 20 million people have been infected, and nearly all countries in the whole world have been affected. And that this is it's a dangerous virus because it spreads very quickly. If you compare this to, say, a virus, another pandemic that is ongoing in Africa, which is the HIV/AIDS, which has infected more than 70 million people, but it took 40 years to get to that number. So it tells you how dangerous and how important. The importance we should lay on preventing or controlling the current COVID-19. So the three major lessons are that we are more globalized than we thought, and COVID has exposed that. The second thing is that we need enhanced awareness of a common vulnerability, that no country is secured except all countries are secured, including Africa, a continent of 1.3 billion. And lastly, that we have to demonstrate shared responsibility to address the inequalities that exist across the world. And Africa is ready to place its leadership role. As a continent, we face three pockets of serious disease burden: the emerging infections, and I'll come back to that shortly, that including the Ebola that we are dealing with and currently dealing with in Congo, and measles outbreaks and others. We have pandemics, existing pandemics like HIV/AIDS. We have challenges of endemic diseases like TB, malaria, and immunization programs, and the rising rates of non-communicable diseases. If you put all of these diseases together, our statistics suggest that they account for about 227 million years of healthy life lost per year in Africa. And that translates to a loss in economy of about 600 billion overall as a continent. Very importantly, I think permit me quote one of our important founding fathers, Kwame Nkrumah, who said on May 24, 1963, that Africa has to be united now or perish. And that quotation has never been that relevant than today. Today is a historic moment for the continent because we face a pandemic that we must fight and win, and do that collaboratively. We face a pandemic that will undermine all our economic gains, that we've all our vision and aspiration as a continent. So if we were to move forward, there are three key areas that the partnership will be very, very relevant. First of all, we need to invest in our public health institutions, including the strengthening of the Africa CDC, its regional collaborating centers, and national public health institutes within each country. That will become the serious and important architecture that will ensure the security of the health security of our countries. That also comes with the need to strengthen hospitals and clinics that are all part of the health system, a functional health system in the country, which relies on the need to prevent and the needs to cure. The second area is actually workforce development, a competency-based workforce development. And lastly, local manufacturing for both diagnostics and vaccines and therapies. The continent COVID-19 has exposed the continent significantly in all three areas of disease prevention, that is diagnostics, treatment, as well as vaccines, where we do not produce any of those. As we speak, only one vaccine clinical trial is taking place on the continent. So we are very appreciative to hear as Africa CDC the $4 billion that is being discussed at the table. We hope that through this commitment and responsiveness, that these areas are aligned will benefit from strengthening in Africa, so that we ensure the fundamentals of our health security that will guarantee our economic growth. Let me just end with a quote from Chairman Mao, who says, "The people and the people alone are the motive force on the making of the world history." And this is truly the historic moment that the people-to-people relationship between China and Africa is critical for us to achieve the joint vision and make sure that our health system are strengthened in a more holistic way. Thank you for your attention.
And that's all we have time for this week on this edition of Talk Africa from the webinar on China-Africa Joint Response Against COVID-19. Special thanks to all my panelists. Remember, we'd love to hear your feedback, and do keep the conversation going online through our YouTube, Twitter, and Facebook handles. And join us again next week for more Talk Africa. From me, Beatrice Marshall, it's goodbye.